Tasha, if you want to, yeah. All right, we have 4:15 and I'm Terry Barningham. I'm the Director for Health and Human Services. Because this is an organizational year and an election year, I will be opening up the meeting, calling the meeting to order. And then we'll go through the election of the chair, and whoever is chair will take over at that point. So we'll officially call the meeting to order. And Lisa, if you could do roll call.
Clarence Campbell.
Here.
George Busse.
Here.
Laura Negro. Elizabeth Franick.
Here.
Beth Garrett.
Here.
Dr. Horning.
Here.
Joy Henriksen. Here. Terry Verville.
Here.
Dr. Keller.
Here.
Okay, that's it.
Okay. So I'd just like to welcome the two new board members that we have. We have Beth Garrett, who is a county board supervisor who was appointed to our committee. So welcome, Beth. And we also have Terry Verville, who is our community representative, our citizen at large. And she is replacing Laura Cruz. So welcome to our new board members. And then we will just roll right into the election of the chair. So I will accept nominations for chair, please. And you can appoint yourself.
George Busse would like to nominate Clarence Campbell for chair.
Second.
He's giggling. Any other nominations for chair? Any other nominations for chair? Any other nominations for chair? Okay. All those in favor of Clarence Campbell for chair, please say aye.
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 Opposed, say no. Congratulations to Clarence, our new chair. Our new existing old chair. Congratulations. And I'll let you take over.
So now elect the vice chair. I'm trying to remember who is George, are you our vice chair now or
No,
Laura?
not me.
Was it Rich? Okay, that's right, it was Rich. Okay. So I'll open nominations for vice chair.
This is Matt. I would nominate Beth Garrett.
I like that.
I was going to, do I have to accept or decline or?
You can,
Okay.
I mean,
I think I will decline that, being such a newbie. I don't feel ready, but I was going to Liz Franick, or Franick.
I don't think I can do it, because there's a lot of times that I have to work. So I don't want to accept the nomination because of that. Sorry, folks.
Who are the voting members here on this committee?
yeah, for the benefit of the new members, maybe you can.
Yeah, so all the board members, I have all the voting rights is Clarence, George, Laura Negro, Elizabeth Franick, yourself, Dr. Keller, Dr. Horning, Joy, and Terry Verville. So those are the possibilities.
I don't know that it has to be a county board member that's vice chair, but I don't know that for sure. Do you, Terry?
I think formally it does, but then if they don't show up, there's a succession of people who can play that role in the interim.
Then do you want me to give you just the board? So then
Let me ask you, George, would you be willing to be the vice chair?
Would rather not, but if we're in a pinch, I'll do it. But I think Laura Negro would be excellent.
Especially since she's not here. Is that a nomination?
I'll nominate Laura, sure.
I'll second that.
Are there any other nominations for vice chair?
Well, I'll nominate George, officially, so.
Darn.
Are there any other nominations? Are there any other nominations? Any other nominations? And we'll close nominations and vote.
You ended with Laura Negro and George.
George Busse.
Yeah.
We want to just, do we want to have a, how do we want to vote?
Last year you guys just did the ayes.
Yeah.
So that's
All in favor of Laura Negro as vice chair?
Yes.
Yeah,
Yeah,
And non-county board members can, should also vote.
we gotta find out if she wants to do it.
I think I counted 4. Yes.
Dr. Keller, yeah, I've got, George said yes, Elizabeth Frank said yes. I thought that was Terry Burville. Terry Burville, did you say yes on that one?
Liz, I think Liz said, yeah.
Oh, Liz.
Liz
Yeah, Liz
Yeah.
Frank
and
Yeah.
Dr. Keller.
and Dr. Keller. So, yeah, so I thought I heard a 4th one though. Did Terry Burville, did you vote? Is she here?
I heard
She's trying to
one.
unmute. Okay, so for Laura Negro, we have George is a yes.
I did say yes to the vice chair of Laura Negro.
Okay, so I've got George, Liz Franick, Terry Burville, and Dr. Keller were yeses.
And I'll vote yes for Liz,
Okay.
for Laura.
For Laura, okay.
And then all in favor of George Busse as vice chair?
Yes.
Matt, yes.
Yes.
Beth, Joy, Dr. Horning. I guess, is that it?
Correct.
Okay.
Mhm.
So Laura Negro is our vice chair.
Yeah.
Right.
So yeah, she does have the majority, but we're missing one. Oh, Laura Negro, she's not here. Okay. Yeah.
She voted for herself.
Yeah.
Okay,
Okay.
so Laura is our vice chair. Next item is approval of the agenda.
Oh, I had one note on the agenda.
Okay, Beth, go
I
ahead.
just noticed that in number 9 of the minutes, it's there, Dr. Honig expressed concerns and questions regarding line 5, and George asked about extra water. And C. Campbell suggested that this topic be discussed at the next meeting, but I don't see it on the agenda of this meeting. With reference to line 5. Was that? Yes.
So this needs to be added to the agenda.
Or for the next meeting.
So those are the things, yes.
I just wanted to last.
Yeah, okay.
Earlier.
What would you prefer? Would you prefer to add it to this agenda or just make sure we have it on the next meeting? Next meeting won't be until June.
I guess I would refer to Dr. Horning and George, or since they brought it up. If they'd rather speak to it again tonight or wait till June.
What are your thoughts, Matt and George?
The people in the room might have to speak up a little bit. It's a little hard to hear some of you online.
The question was, at last meeting, we discussed the water issues and water quality issues regarding line 5. And it was suggested that we put that on the agenda for this meeting, and Beth is asking if, it's not on the agenda. Should we add it to the agenda tonight, or should we put that off until the next meeting in June?
I'd like to see that on tonight's agenda.
I don't know if we can do that because we didn't notice it.
It's been published already, so.
Yeah. And I thought George, when you brought it up, that you were concerned over the role of public health within this, as far as what Enbridge coming in would bring, as far as law enforcement issues, crimes, sex trafficking, those kind of things. And when I talked to Dan Grady, he said those are all issues public health would not, or Health and Human Services as a whole, would not, it would not be in our wheelhouse to do. It wouldn't be in our control. That would all be law enforcement and the city of Ashland and different things that we would not have control over. We would respond to after it happened, but we wouldn't have any kind of authority over any of the issues that were raised.
The other things brought up were PFAS, extra dust in the air, and water quality.
And that would be the DNR and environmental protection. So we would be a response. We would not be able to change any kind of actions in advance, is what my discussion with Dan resulted in. So he said not to put it on the agenda. George, you're muted.
I'm just saying, isn't that a question in these cases of our preparedness to respond? And it seems to me our preparedness.
Well, we do have emergency management, and we have a preparedness, a whole manual of how to respond to those kind of things. So, you know, every event might be a little different, but we do have a platform for that.
Okay.
Yeah, one thing I think we talked about also was like private wells and monitoring, which is clearly like within our wheelhouse. And yeah, I guess I thought we were, yeah, and I didn't know that Dan had weighed in on some of these things and said none of this is in our lane. But I think there are a lot of elements of the project that do sort of intersect with health and human services, mostly public health. But yeah, I guess it maybe is worth spending some time in between meetings figuring out what are the germane topics for health and human services, what isn't our business. You know, yeah, maybe trafficking isn't our business, but dealing with, you know, yeah, testing for infections and tracking of infections is. And so, you know what I mean? I think there's, yeah, I think that was, it was brought up because, yeah, I don't have a perfect sense of what should be on our agenda and what shouldn't, but I do think there are topics that clearly are on our agenda. I mean, we talk about water and well testing and those types of things. So.
And we do have the contract with the DNR for well testing, so that would be something we continue to do, but we already do as well. So,
You know, I looked at the village, well, I call it Enbridge Village. So there are at least a dozen completed cabins for housing and probably 24, maybe 20 RV sites with water, sewer, and electric. So there are going to be a lot of folks out there.
Well, let's get back. The agenda item we're on right now is the approval of the agenda. So maybe we should do that first.
Given what we've heard, I move to approve the agenda as written.
Motion by Beth and seconded by Joy to approve the agenda. All in favor?
Aye.
Right.
No,
Is that one no? Okay,
Yeah, Elizabeth Brannick said no.
okay. Next item then is public comment pertinent to agenda items and resolutions and ordinances. There's no public here in the room. Anybody online?
No.
I don't see anybody. So we'll move on to approval of the minutes of the last meeting. Anyone care to make a motion on the minutes of the last meeting?
I'll make a motion.
Do I make some motion to approve?
I'll second.
Dr. Keller seconds. Any comments, additions, or corrections to the minutes? Otherwise, all in favor of approving the minutes signify by saying aye.
Aye.
Opposed? Motion carries. 2025 end of year expenditures. Amber.
That's me. Okay. Before I start rambling on, does anybody have any questions to start with? Yes.
I assume MA means like Medicare or something like that.
Oh, I got it. Yeah. Yep, that's exactly what that means. Okay, so
Medicaid, not Medicare.
okay. Don't know what I said, but yes, thank you. Because I actually switch those two things around often, and that's not a good thing. Okay. Here's my 24. So I did include a copy of 2024 so that you could compare to. Very high overview when you just look at the very top box on here. This is taken all of our expenses of all of our revenue and putting it all together in a nice little package. So overall, you could see you know, a pretty good year. We had some things over, some things under. Personnel came in under. We were understaffed. I did budget to be understaffed a little bit too, but then still came in under, which in the end is a good thing because you can see our direct cost did come in higher than budgeted. We did get more revenue this year. Seeing the more MA fees for service, seeing that go up, I think I'm gonna give some of the credit to our EHR system. And the more that we switch over to it, the more we're capturing more billing. And not missing out on any on anything. So if we build to something get denied, like we're able to watch it from step 1 to you know, step 50, and it's all coming through. So seeing that increase this year was that made me happy, and I would accredit that to the staff and using our new HR. Other counties did tell us that we would see it. And now I see it and I believe them. So that's good. And hopefully we can at least continue or maintain that this year and keep going for that. We got a little bit less in grants, but that's just what we estimated in the summer. So it's kind of hard to predict. Overall, I think we came out pretty good. Does anybody have any questions for me on any of this stuff? Do we want to dive deep? Because I could talk a long time and I also don't want to ramble on. And if you guys got more you want to dig into, we can. But and you can see each program is was a little bit under, a little bit over, but then overall in the end, that's what we like to see. And this is normal to see those highs and lows. 2026, too early to know how we're going to be looking for this year, but in June we'll hopefully have an idea of at least how the first quarter is going.
Any questions of Amber?
I should make a note too, this could change some, but we did have the auditors here last week, so there could be some audit entries, but overall, we've either predicted or have recorded all the money that we anticipate that might still come through the end of May. And anything that we get above and beyond could would end up now in 2026, but it could change some with added entries. But overall, this is pretty close to a final report for the year.
What is their budget calendar? Is it
When do we start preparing it?
is it like April to April? Or
Oh,
May, or-
it's calendar year, so January through
calendar
December.
year,
Yep.
Always a delay because you have some things coming in after the first of the year.
Yeah, sometimes we get grants, 6 months after it started. Liz was really like a lot of her stuff was iffy. There was, more so for this year, we didn't include that we'd get revenue and then, oh wait, maybe we're gonna get it now. And it's been a very yo-yo kind of a thing for some of her programs. But yeah, so we'll start preparing for 2027 here in the very near future. In June, we'll start talking and using what we have, know up to date and start predicting next year. So
May I ask who does most of the grant writing for this group?
Everybody.
all the department heads do them. Yeah, they do their own. Yeah. And they do a good job.
Departments each kind of look out for grants for themselves and
Hmm.
apply as they see fit.
And Terry Barnham also
Mhm.
does some grant writing too, so she's always looking out.
Any other questions regarding the financial report?
Appreciate how clear it is. Thank you.
Mhm.
Really, really nice and readable. Thank you.
You're welcome.
We'll move on then to public health update.
All right, I just have kind of a smattering of a variety of updates. The new water rates and the DAP cap fees that were approved at the last board meeting are in effect, and so far everything is going well with those. I haven't been informed of any conflicts or anyone being upset over the tourist rooming house rates. It's gone well so far. Springtime, we generally see a smattering of reports of human health hazards, which has been holding true for this year as well. We've had some rather interesting ones. So a lot of interdepartments working together for those, working with the children's unit, working with law enforcement. We've had the one I was out on today was a nice resolution. Some of the other ones are still a work in progress. So pretty typical for this time of year. For grant updates, we've applied for the next round of drug checking technologies. So waiting for approval on that. So that's our fentanyl test strips, xylazine test strips that we use that to supply for the vending machines. Also applied for the next round of the Wisconsin Lead Safe Homes program. That one was just submitted last week, so it usually takes about a month for them to get back to us on that. We do have a staff member who has completed their training for lead risk assessor, so we will be all set to go, presuming that we have that grant renewed. I think this will be our 6th year that we've had the Wisconsin Lead Safe Homes program, assuming it's approved. In 2025, we were able to complete a large project of lead abatement for a property within the city of Ashland for children with elevated blood lead levels. So we're always on the lookout for those projects. The Wisconsin Beaches program with the DNR will be starting soon. That starts in May, so summertime is coming quickly. We are contracting again with Bayfield County this year. Previously, this contract used to go with Northland College. However, with the college being closed, Last year we had switched to Bayfield County because they do have a staff member in Ashland that can pick up the beach water samples, so it cuts down on transportation costs and mileage. So we're continuing with them. And then our state crisis intervention program, or the SCIP grant, Hunter Safety Education as Harm Reduction. Our first class was completed in March. We are working on scheduling a bunch more classes. I've got contacts out for all of the school districts, so we're just trying to work on coordinating schedules for all of that. And we do have gun locks in all of the public health vending machines. We've distributed roughly 60 gun locks through the vending machines thus far. So, any questions?
Where are the vending machines located?
We have one vending machine here in our front entrance. There's one in the fire department main entrance vestibule, so that one's accessible 24/7. There's one inside the smoke shop out by Walmart, and then Bad River has one that's accessible 24/7. Currently located in a fancy little environmental controlled shed behind the public safety building, but they do have plans to move that closer to their harm reduction building.
Okay. Great. Do you mind telling me to the first, should I be addressing you?
No, go
Okay.
ahead.
You said human health hazard, we always get human health hazards this time of year or something like that. I don't know what that is. What is that?
There's a variety of things. So it's Ashland County, there's a ordinance for Ashland County, it's the human health hazard, it's 10/2003, I don't remember, 49, I think. So there's several different criteria that constitute a human health hazard. One example, completely random thing, is unattended refrigerators or freezers.
Oh, okay.
If people leave them sitting out, on their property someplace, we've had them where they're like sitting at the end of people's driveways. It's a human health hazard because, heaven forbid a small child climbs into it, closes the door, it's an airtight seal. Yeah. Or like the one that I've been dealing with this week is improper disposal or unburied livestock carcasses. Is a violation of the human health hazard ordinance and also Wisconsin statute 95.5. Livestock not intended for human consumption needs to be disposed of within 24 to 48 hours for the months of April through November in the state of Wisconsin. Sometimes we need to be creative because the road bans are still on, so you can't exactly bring a backhoe down a logging road or a gravel road that is someone's driveway because it would squash the road with the road bans. So we work with people on how to properly dispose of livestock sometimes.
Interesting. Okay. Thank you. Okay, got it.
Road bans are being looked at Friday. Did you see that? If
Are
that
they up
helps
on
you.
Friday?
Yeah.
Okay.
For
That's good to know.
Ashland County anyways, yes.
No, we were good today. Everything was taken care of. We're good to go.
I'll double check.
Any other questions for Liz? Okay, then the next item is written materials, and any of the supervisors want to highlight anything that's in their written materials, or do any of our board members have any question about anything that's in the written materials?
I just have one question. I'm not sure if it's in the materials or not. I know other states are passing the food stamp program. They're not going to agree with covering certain items. Do we see, is that going to affect any benefits? Are they going to reduce the benefits? Are they going to do anything to increase the benefit, or, you know, is it going to accommodate for not having those items?
So I'll start and Amy can step in, but that was added to the bill so that they could pass it, so that we would get $69 million to do quality assurance for the program. So they have to seek a waiver, so it's not done. They would have to seek a waiver from Medicaid. No, I'm sorry, SNAP, to limit soft drinks and candy. So it's not done, but it will not affect their benefits overall. Go ahead, Amy.
You took the words right out of my mouth. It won't affect the amount of benefit that they receive. It's just going to restrict the soft drinks and the candy from being purchased with SNAP funds. That's all.
Thank you.
Any other comments or questions?
If I'm reading this correctly, the cost of children's subcare on page 13 of 51, we have a pretty substantial drop in 2026 from the number of children. So that's kind of good, isn't it? Or is there a reason for that from 2025 and even lower than 2024, like step down each year? Is it because we don't have as many places to put?
No, well, actually, it's kind of reflective also if you go down to the subsidized guardianship where there's the increase. So with subsidized guardianship, that means the child, there's been permanence established. So it's kind of.
I see.
That. Yeah.
Okay, thanks.
I have another question. I'm sorry. Like children in the substitute care like that, or going to mental health facilities and all that. If we see the upticks in the future, what kind of things do you think that the Health and Human Services could, you know, is there any programs that work with the schools to find out how we can prevent these, you know, kids going away? Are there any different kinds of learning environments that are more detrimental to these children that feel like they're lost or depressed or having other issues? I don't know, you know, where we can help with that, but I mean, if we could, it'd be just wonderful.
Well, and I think the Spark program has a good leg up on that already, because they do understand that all children don't learn all the same way. So they have different techniques and different ways of teaching things, and that's been very effective. Our Spark program is actually a substance abuse prevention program, but it also wraps in mental illness, mental health. It gives them a trusted adult to have for a mentor. Some of the staff there are lived experts, so they have experience with some of the issues the kids are dealing with. So that's probably our biggest thing. And Scott works hand in hand with the school on a regular basis. So we did have the Ignite program. We still have the Ignite program. We had a different program with some short-term one-time funding to help kids who were falling behind because of COVID and not attending school during that period. And that was to help them catch up and graduate. And so a lot of those techniques, working with these kids, knowing that they probably need some alternative teaching methods, were put in place, along with a counselor in that program, a mental health counselor who worked one-on-one with them. So I think that's probably our biggest prevention item that we have at this point, and it has been effective. The numbers show it.
I was gonna say,
Thank you.
our program as well for CCS works with Spark, Children's Unit, all the above.
For any kids that have mental health or substance use issues, we can enroll them within our program and offer services. And extra support outside of school.
Thank you, ladies.
Anything else?
Are these programs offered regardless of citizenship or any kind of things like that? Is any of that asked for?
So our program, the requirements are they need to have either a mental health or substance use diagnoses, and they need to have MA. So
Okay.
that's the requirements to enter into our program.
In Spark, the only application is you have to be in middle school.
Okay.
You have to be entering.
Does Ashland have any English as a second language programs at all for any students that may want to enroll in public school that speak a different language, such as from Ukraine countries or Spanish speaking, any other Laotian, any other Russian, anything?
Not that I'm aware of. You know, they have to probably provide translation services, but I don't think they have any kind of immersion program because they don't have the amount of children to be able to fund that resource, would be my understanding.
Yeah, I know there's a community liaison. I'm probably getting her title right. But I know she does help to facilitate connections through the school district. She's worked with a few families.
Thank you.
Anything else? We'll move on to board member updates and future agenda items. Did George leave the meeting? I don't see him up there anymore. Well, there he is. Just didn't see you on the screen, George. I thought maybe you left.
I'm still here, but I have nothing for the future to add. Not yet.
Anything else that any of the board members wanted to bring up or ask about?
I would like to have like a discussion, agenda item pertaining to line 5. If any public has anything to weigh in that, they feel like the public health nurse or anybody could, speculate, future. And, I feel like Health and Human Services should have, at least some education portion of this, so to educate the public, so people are not so frightened about, things that are going to happen or could happen. And like we said, that there's different committees that will handle this, but I feel like, like Dr. Horning had mentioned about our potential of our drinking water, for the future, and our watersheds and everything like that. And I feel like that is like a public health thing. And, even women that could be potentially sex trafficked, children being exposed to more crime, more drugs in the area, things like that. I feel like that is, and we constantly need to update the public about the future of the homeless population. I'm hoping that with new housing coming, that will alleviate some of it. And, what can we do for folks that are not willing to comply with drug rehab and stuff like that? What areas can we work on with the public? Thank you.
Liz, when you talk about sex trafficking, Health and Human Services would only be involved if it was a minor child. Otherwise, we have no
Okay.
jurisdiction over that. As far as people complying with rehabilitation for drugs, we offer services, but they're all voluntary at this point, unless they pose a danger to themselves or others, an imminent danger to themselves or others. And then we can go to court and get a court order for them to be placed in rehabilitation. But it's a high bar to pass. So most of our services are either preventative or voluntary, or in those other circumstances, they'd have to be court ordered. But it's really hard to make somebody go to rehabilitation when they're not ready. It's oftentimes not effective either because they might be fighting it and not open to the education and services that they're receiving. So I'm not really sure what, as far as the rehabilitation piece is, what you would want us to do or what the focus would be.
Okay. Yeah, I just feel like it should be like an open topic that, you know, we can educate the public about. Like, it's really good to have the public health update, but if any public has any questions or anything, you know, to have it on the agenda as an item where people can just give feedback or something, where maybe there's something, maybe there's a missing link that we've never thought about with homeless, drug prevention. Oh, and it would be wonderful to have the children or the parents of the children from the Spark program speak on behalf of that program, you know, because if it's on record, then the state, you know, can look that up in the future if there's any questioning of funding or whoever funds that source. Any, you know, people that have been through drug rehab that would like to speak or anything like that, I'd like to, you know, have something that we can have an agenda topic so people can speak on those issues and about the potential of the environmental portion of line 5. Thank you so much.
Yeah, I agree with that. I think the point of putting it on the agenda is to allow the public to express any concerns that they might have. It's not that we have something necessarily to talk about. It's to give a chance for the public to express their concerns as to any perceived health issues that they may have with regard to the pipeline project. But it doesn't hurt to put it on the agenda. We have nothing to talk about. No one shows up to comment in public comment. We just skip over it. But I think it's appropriate to put it on the agenda.
Okay.
Any other thoughts or comments?
I agree with that. And I also do have a question, just because I come across I didn't even know this was possible, but there's a child that has been expelled from elementary school here in Ashland. I'm wondering if there's how we monitor that situation. I didn't know you could be expelled from elementary school.
That's interesting. We were just talking about that in management this morning. I'm on the Children, Youth, and Families Policy Advisory Committee for the state. And they were talking about it last week or the week before. The Department of Instruction has actually no say over or authority over who schools expel, nor does the Department of Children and Families. So that was interesting, but that was a topic. So I will tell you though, as I mentioned to my staff this morning, Scott, who does our Brighter Futures initiative, went to an expulsion hearing for one of the kids that he works with. And he was there to advocate, but when he saw all the evidence in the tapes and heard what had happened, he said he felt the school did the right thing. And he's a fighter, he's an advocate. So if he thought there was any way that, he could plea for the case, he would have. He spent his time going up there to advocate, but yeah, so even the Department of Public Instruction has no say over the expulsions, is my understanding, based on my meeting last week.
Is it still true that a child who is expelled from campus still receives tutoring and continues their education, even though it's off campus? Or is that a separate category?
Carrie, do you want me can say anything?
Yes, please.
Okay.
Yeah.
I didn't want to overstep, but I am on the Ashland School Board, and yes, when a child is expelled, they receive tutoring and services off campus. There's certain criteria they have to follow. They have to get I have not expelled a student that hasn't been required to get mental health counseling and be evaluated by a doctor or mental health before returning to school when they are allowed to return to school, that we need something saying that it is safe for them to return to school. And yes, they receive tutoring and education and have to keep their grades up in order to return whenever their return date might be.
That's good to hear. I'm glad. I didn't know they would just immediately could be considered homeschooled, in which case I'm wondering if we have ongoing family and parenting skills classes that we
Spark, I just went through a parenting class through Spark, actually, it was an 8-week course. So there, and then UW Extension also has quite a few positive parenting, virtual classes that you can sign up for online. So there are actually quite a few resources, out there.
And to the younger, the Shawangin Pregnancy Center, which is also called something else now, Echo provides parenting classes also.
Yeah.
And those are voluntary though?
Yes.
Everything's voluntary, okay. And then one other thing, these mental health first aid classes, I'm doing into, are we offering any as a county, or is that a nonprofit activity?
They just did one in Bayfield County not that long ago.
I
They had it up in that direction, so like they send any resources our way, so like if our staff want to attend or do any of that, we can sign them up for that as well. We haven't offered them here within Ashland County though. I shouldn't say that the county hasn't offered them, but I know there's been some in our area that they've done.
Any other discussion? Questions, comments?
I would like to put in a plug for Spark. I think it's such an awesome program, as I'm sure you know, but one more voice, and that's it down.
Okay, our next meeting date is June 17th.
And that will be our public hearing as well. And instead of going over to the courthouse like we typically do, it's loud and hot, and we don't have a huge attendance, so we're going to hold it right at the same building you're at right now at Sanborn. So
Other than that, there's nothing else on the agenda, so
I'll move to adjourn.
we don't need a second, but Dr. Keller will second that. All in favor?
Aye.
Aye.
Anybody opposed to adjourning? Otherwise, we are adjourned.